In the UK, 1.5 million people are estimated to be on some kind of weight loss medication. These GLP-1 drugs work to reduce your appetite and decrease digestion. For some, they have been life-changing.
The thing that it's helped most with is by curbing your appetite, it allows you to kind of stick to a healthier diet and a healthier routine. So I've lost, since I started, I think it's 50, 51 kilos, something like that.
While the medicines are available on the NHS, even in the UK, supply is very limited and most sourced privately. So it's been a real challenge to source them for the Falklands.
The pharmacists have reached out to all of the manufacturers who make these drugs, and we've had a hard not interested from most of them. The drug companies are not going to make a great deal of money from us. They're not cheap. It would work out at roughly £2,500 per year per patient. If we offered this drug and it was accepted by everybody who could potentially have it, it was going to cost an extra 1.5 million in our drugs budget.
Although the medicines have not been available through the KAMH, as in the UK, people here have been sourcing them privately. The medicines have potential to do great good, but aren't without risks, especially when sourced from abroad.
If they're bought privately, you've got to make sure they're from a reputable clinic, and it's very difficult for people to do their own due diligence on that. It's really, really important that people come in and get checked, and not just for having a weigh-in. It's also really important that people understand that you will lose body fat quite quickly on these medicines, but you also lose your muscle mass very quickly. You have to do resistance training, weight training to keep that build-up of your muscles. Otherwise, you become very weak. If you take other tablets, those tablets might not be absorbed.
The main side effect profiles, I think, are mainly like digestive, acid reflux, nausea, sulfur burps is another. That's not very pleasant. One of the things that I do focus on is like keeping my protein intake relatively high, because that can help retain your muscle mass as well.
Despite the risks, the hospital and government have been working hard to get the medicines here, and progress has been made.
Novo Nordisk, who make Wegovy, they are willing to sell us some drugs. So we're hopeful that we might be able to start getting a very limited supply in, but for a very strict group of patients. Diabetic patients who have a body mass index of greater than 40. And even that is going to cost probably about an extra £40,000 on our drugs budget.
But despite the challenges, there is still significant political will to bring the medicines here.
Once the decision's being made, the monies will be found, probably internally in the existing budget, but if necessary, I have no doubt that the monies will be found, because it's all to do with health and the knock-on of assisting people with weight loss. There will be gains elsewhere, so I wouldn't particularly worry about that.
Even more concrete progress has been made this week, as the Health and Medical Services Committee announced plans to have the medicines here for named patients as early as January. When patents expire and prices reduce, the hospital hope to be able to expand their offering to people other than diabetics with a BMI over 40.
Over time, we might bring that down, so any diabetic with a BMI of 37.5, 35, then we might open it up to some of the other groups of people, particularly people who are waiting for maybe joint replacements that can't have their joints replaced because they are deemed unsafe to have their surgery because their body mass index is too high.
While the future remains vague, it seems likely that these new medicines will be able to help people here very soon.
This medication, it's kind of just like a helpful crutch. You shouldn't like rely on it completely. It's not going to solve everyone's problems, but it does really help.